GLP-1 medications have become the most talked about drugs in a generation. Names like Ozempic, Wegovy, and Mounjaro dominate headlines, celebrity interviews, and dinner table conversations alike. But beneath the celebrity endorsements and social media buzz, what does the actual research tell us? Today we're cutting through the noise with evidence from major medical institutions. From Harvard Medical School to Johns Hopkins, researchers are discovering that these medications may do far more than help people lose weight. Here's what surprised even the scientists. These drugs appear to protect the heart, reduce cravings for alcohol and other substances, and may even slow cognitive decline. But there are also important limitations that rarely make the headlines. Up to 40% of the weight people lose might be coming from muscle, not fat. And most clinical trials? Funded by the drug manufacturers themselves. So let's look at what we actually know, what we don't, and what it all means for your health decisions. First, a quick primer on what these medications actually are. GLP-1 stands for glucagon-like peptide 1, a hormone your body naturally produces after eating. This hormone signals your brain that you're full, slow stomach emptying, and helps regulate blood sugar. The medications mimic this natural process, just more powerfully. Scientists originally developed these drugs for type 2 diabetes. The weight loss was actually considered a side effect. Sometimes the side effects become the main event. Today, these medications represent a genuine paradigm shift in how medicine approaches obesity, treating it as a chronic metabolic condition rather than simply a matter of willpower. Let's talk numbers. Clinical trials show significant variation between different GLP-1 medications. Liraglutide produces about 5% weight loss beyond placebo. Semaglutide, the active ingredient in Ozempic and Wegovy, shows approximately 12% placebo-corrected weight loss in trials. And tirzepatide, sold as Mounjaro and Zepbound, demonstrates the highest efficacy at around 18% weight loss compared to placebo. Here's something researchers didn't fully anticipate. According to a major study from Washington University's School of Medicine, these drugs do far more than reduce appetite. GLP-1 medications showed a 40% relative risk reduction for heart failure with preserved ejection fraction. That's a remarkable finding for a weight loss drug. As Nils Kruger from Harvard Medical School noted, a 40% reduction is something you don't see for every drug. That's a genuinely significant protective effect. The Washington University study also found reduced risks of seizures among GLP-1 users, an unexpected neurological benefit that researchers are still working to understand. Perhaps most surprising, reduced addiction risk. The study found lower rates of addiction to alcohol, cannabis, stimulants, and even opioids among those taking these medications. Why would a weight loss medication affect addiction? Scientists believe it relates to how GLP-1 acts in the brain's reward pathways, the same circuits involved in both food cravings and substance use. According to the Harvard Gazette, more than 15 global clinical trials are currently investigating GLP-1 medications specifically for substance use disorders. The neurological findings don't stop there. Studies showed decreased risk of neurocognitive disorders, including Alzheimer's disease and dementia, among GLP-1 users. Dr. Muthaiya Vaduganathan of Brigham and Women's Hospital put it this way: their role is now being understood to be much more fundamental to human health. But before we get too excited, we need to examine the other side of this story. The science also reveals significant limitations that deserve serious attention. Research from UVA's School of Education and Human Development found that fat-free mass, meaning muscle, accounts for 25 to 40% of total weight lost on these medications. That's a significant concern. Muscle loss can affect metabolism, mobility, and long-term health, especially as we age. It's not just about the number on the scale. The Johns Hopkins Bloomberg School of Public Health also found interesting differences between groups. Women lost about 11% of starting weight compared to about 7% among men. However, the same study confirmed that these medications work comparably across different ages, races, and starting weights, which is encouraging for equity in treatment. Now we need to address the elephant in the room. Most of the clinical trials were funded by the pharmaceutical companies that make these drugs. That doesn't automatically mean the research is flawed, but it does warrant healthy skepticism. Independent, long-term studies are still catching up. According to Science Daily's coverage of recent research, we have limited long-term safety data beyond 2 to 3 years. These medications are relatively new in their current widespread use. There's also the question of sustainability. What happens when people stop taking these medications? Research suggests most people regain a significant portion of the weight. The JCI review notes common gastrointestinal side effects including nausea, diarrhea, and constipation, which affect a substantial portion of users, though they usually improve over time. Access remains a significant barrier. Many insurance plans don't cover these medications for weight loss, and out-of-pocket costs can exceed $1,000 per month. So what should you do with all this information? First and most importantly, consult your doctor before making any decisions about GLP-1 medications. If you're considering these medications, ask about the full picture, including potential muscle loss, what happens after discontinuation, and whether your insurance covers them. The evidence strongly suggests that if you do take GLP-1 medications, incorporating resistance training can help preserve muscle mass during weight loss. Practical tip: start with lighter weights and gradually increase. The goal is maintaining the muscle you have, not necessarily building significant new mass while on these medications. Monitor your body's response carefully. Keep track of gastrointestinal symptoms, energy levels, and how your clothes fit, not just the scale number. Remember that the cardiovascular and neurological benefits may extend beyond weight loss itself. Some researchers believe these medications have direct protective effects on multiple organ systems. That said, we're still in the early chapters of understanding these medications. The science is evolving rapidly, and what we know today may be refined by future research. Be wary of anyone claiming these medications are a simple solution. Weight management remains complex, involving diet, exercise, sleep, stress, and yes, sometimes medication. If you found this breakdown helpful, consider subscribing. We cover evidence-based health topics like this regularly, always looking at what the research actually says. According to the ongoing trials tracked by Harvard, researchers are investigating whether GLP-1 medications might help with conditions ranging from Parkinson's disease to fatty liver disease. The potential scope of these medications keeps surprising scientists. What started as a diabetes drug may turn out to be something far more significant for human health. But here's the most important takeaway: these are powerful medications with real benefits and real limitations. The decision to use them deserves careful thought and medical guidance. Weight loss medications are not a moral failing to consider, nor are they a magic solution. They're a medical tool that may be appropriate for some people in some situations. The evidence from Johns Hopkins confirms that age, race, and starting weight don't significantly affect how well these medications work, making them broadly applicable across populations. If cost is a barrier, ask your doctor about patient assistance programs. Many manufacturers offer reduced pricing for qualifying patients, and some clinics can help navigate coverage options. Don't be afraid to ask questions. Your doctor should be able to explain the expected benefits, potential side effects, and monitoring plan for your specific situation. The landscape of obesity treatment has genuinely changed. For the first time, we have medications that produce significant, sustained weight loss for many people who struggled with other approaches. The cardiovascular protection alone, with that 40% heart failure risk reduction, represents a potential paradigm shift in how we think about these medications. At the same time, we should remember that pharmaceutical solutions exist within a broader context of food systems, economics, and social factors that contribute to metabolic health. Medications can be part of the solution, but they work best alongside sustainable lifestyle habits, regular movement, adequate sleep, stress management, and nutritious food choices. The addiction research is particularly intriguing. If future studies confirm that these medications help reduce substance cravings, we may be looking at a significant new tool for addiction medicine. With 15-plus clinical trials underway investigating substance use disorders, we should have much better data within the next few years about these potential applications. The neurological findings about reduced Alzheimer's and dementia risk are preliminary but exciting. If confirmed, GLP-1 medications might offer benefits that extend well beyond weight management. Whatever you decide about these medications, remember that health is not a single number on a scale. It's how you feel, how you function, and how you can engage with the life you want to live. GLP-1 medications represent genuine scientific progress. They're not perfect, they're not for everyone, but for some people they offer meaningful help that wasn't available before. The research continues to evolve. What we know about these medications today will likely be refined and expanded in the coming years. That's how good science works. Thanks for spending time with Better Health Faster. We'll keep following the evidence and bringing you research-based information you can actually use. Until next time, take good care.